Hello guys, I hope you are all doing well. Welcome and welcome back to my YouTube channel and welcome to Talk to Your Midwife session. Oh my god, today we have yet another episode or another video about talking to your midwife. And if you have not watched my previous videos, especially the labor series, the signs of labor, how you can recognize whether you are in labor, how we do induction of labor and all that, make sure you watch all those videos so that when you're watching this one now, you already know, you already have some information about labor, about what happens during the labor, during pregnancy, and also during labor, and also in case you are for induction or induction has been done to you, you already have information on how it goes about. We already tackled the first stage of labor. We said labor is happens or occurs in stages. We already covered the first stage of labor, and today I am here to cover the second stage of labor. Oh my god, I don't know whether you know that second stage of labor is the cornerstone of labor itself, the whole labor process. Now, second stage of labor is the cornerstone of it. That is, we call it the baby receiving stage, or this is the stage in which our baby finally comes to the world. This is the stage in which we finally get to receive our bundle of joy. So this is a very crucial stage of labor, and in case care is not taken, keen care is not taken to the mother, we can easily lose the mother, or we can easily lose the baby, especially the baby. That is why you find that a lot of midwives, a lot of us midwives and nurses and also doctors who work in labor ward, when we are in the second stage of labor, that is when everything else stops, and everyone now, their mind and everything else is focused on this mother who is on second stage of labor, because just some delaying, 2 minutes delaying, 1 second delaying, we can easily lose a baby throughout our unborn baby through delay or through neglect. So welcome as we talk about the second stage of labor. So second stage of labor starts when our mom is fully dilated. The cervix of our mother in labor is fully dilated. Remember the first stage of labor, that is when the mother labors, gets the uterine contractions from mild contractions to moderate contractions. Now at second stage of labor, it means that you have already strong contractions. Okay. Now at this stage, we have strong contractions, and from what we feel, we have a sheet of paper we fill in a patient's file, in a mother's file, and we have a sheet called a pathograph, and that is where we get to record the progress of labor, the contractions, the cervical dilatation, and everything that we assess you when we are doing the vaginal examination. Now at second stage of labor, you have strong contractions. And what do we mean by strong contractions? Remember when we were said how we get to assess the contractions, we just put, when the contraction starts, we put our hand on the mother's abdomen or on the mother's uterus, and we get to feel that hardening of the uterus. So once you start a contractions and it is a strong contraction, once I put my hand here and I get to feel those contractions, it means it will go up to 60 seconds. When once it starts, I feel it, and I start my stopwatch. I count it, and it goes up to 60 seconds. 60 seconds is basically 1 whole minute. Okay, 1 whole minute, and others will even extend 1 minute, 1 minute and some other seconds. So once I realize that we are reaching 60 seconds during that contractions, it means I will feel on your pathograph strong contractions. And remember, we said there are things that goes hand in hand. So once we are getting to strong contractions, it means our cervix is opening and opening and opening. We started with 2 centimeters, 4 centimeters, 6 centimeters, 8 centimeters. Now here, because we have very impulsive uterine contractions, they get to open the cervix more and more. So at second stage, our cervix is fully dilated. And when we say fully dilated, we mean 10 centimeters dilated. Now our cervix, our cervical opening, or where the baby will be coming out from, that opening is already fully dilated and ready to occupy your baby and bring out, to allow passage of your baby when you are pushing. Okay. The third thing, well, the first thing is strong contractions. The second thing is fully dilatation of the cervix. The third thing is, remember, your baby is always up here. So when you are in labor, during the first stage of labor, as you are laboring and your contractions keep more and more and more, those contractions keep pushing your baby down and down and down. So when you were starting labor, your tummy was at this point, or your fundus was at this point. Once you continue laboring, it pushes the baby down, down and down. So you realize by the time we are getting into strong contractions or into second stage, your tummy is like from maybe starting from here. Your baby is from here. Your baby is being pushed lower and lower and lower towards the exit. Okay. So the third thing that occurs is descent of the baby. Your baby now, or the presenting part of your unborn baby or the fetus, is already descended. Is from the pelvic cavity and is being pushed out of the pelvic cavity, meaning the head of the baby is approaching the cervix, ready to get out. Okay. The fourth thing that happens, once the baby's head is going down or almost coming out, because our urethra and our anal opening are just below there, and they are almost near the vagina. What happens is, because this baby's head is pushing and stretching the muscles, so what happens is your anal opening, anal opening starts to gape. We call it gaping of the anus. The anus starts to gape. So it's like, because the baby is pushing it out and out. And that is where you find that you as a mother in labor, you'll start feeling the urge to push down, or the urge even to go for your long call, the urge to push your poop. This is because that baby's head is also, when the baby's head is coming down and down pushing, it means it is stretching the anal opening. So in case your anal opening or your anal way had some contents, it means you will definitely empty those contents. And that is why you find that a lot of women in labor get to poop when they are almost delivering their baby. It means the baby's head is here. And that is why we say, as a midwife, when I see you trying to push out poop, or when I see you trying to go for a long call, I will tell you to stop, and I will take you to the labor coach or to the delivery coach where you will deliver your baby, and now start telling you to poop on that coach. Reason is because I am sure and I know that the baby's head is here, and it is the baby's head that is pushing and stretching your anal muscles, and that is why you're feeling like bearing down, you're feeling like pooping. So that is why we keep on encouraging a mom in labor, especially who is in second stage of labor, to keep pushing and pooping, poop and poop and poop, so that you can empty your bowels, so that it creates more space for this baby's head to be able to come out swiftly. So that is another thing that occurs. And when I, as a midwife, realizes that you have gaping of the anus, I definitely start preparing to help you deliver your baby. So those are the things that occurs in second stage of labor. And this is the moment we want you as a mother in labor to cooperate, 100% cooperation. We know, yes, you are in so much pain. We know the contractions are so much impulsive. But remember, my dear, this baby is no longer in the pelvic cavity or in that uterus. The baby is now coming out. Remember, the cervix is the opening where the baby will come out from the uterus. Okay, so when this baby is coming out, remember, this passage is small, so we need this baby to come out as soon as possible, so that the baby will be able even to breathe at their own. Otherwise, in case you delay here, and in case you as a mother in labor is not cooperating well to push this baby out, or you are not ready to give strong pushes to this baby, what happens is the baby's head will keep fixed here. Okay, so ni kama inakwama, it's like it's getting stuck. You start pushing, the head is almost coming, but when you stop pushing, the head still like slides in back. Okay, so what happens is, the more we delay doing this, the more we delay pushing and holding back the baby, pushing and getting the baby's head back, this baby might get some trauma. And that is why you see most of the midwives will even I myself, I would be very lenient and I will be the best. But when it comes to second stage, and you want us to dilly dally, you want us to just buy time and start telling you, oh mom, I know you are in pain. This is serious business, and that is when you'll find that a lot of midwives, a lot of doctors will never joke when it comes to pushing the baby. You'll have to do this. Otherwise, if you delay 2 seconds, we might lose this baby. Okay. And also remember, some babies might have a long cord, that umbilical cord that is supplying the baby with nutrients and oxygen and everything. So you can imagine when the baby is being pushed out and back, that cord might slip because it's slippery. That cord might slip and come near where the baby is being pushed. And you can imagine when the baby's head is struggling to pass and the cord comes near there, it means this cord will be compressed. So what happens when this cord is being compressed? It basically means that your baby will not be getting oxygen. So you can imagine how dangerous that will be, how dangerous it will be when that cord is being pressed and you're still not cooperating to push this baby out so that we can cut the cord and the baby starts to breathe by themselves. So when that compression occurs, my dear, we might lose that baby within a blink of an eye. So always cooperate. When you hear your midwife or your nurse telling you, Mama, this is second stage, just know that this is a no business, no joke, no dilly-dallying, no kubembeleza bembeleza. This is a serious stage when whatever we need from you is cooperation and strong pushing of the baby. You have to push the baby strong and strong and strong. The contractions are compulsive because the uterus knows that now this baby has to come out. And that is why most of the times the contractions might even not give you a break even to breathe. Okay, even if it gives you a break, it is like 30 seconds, just 30 seconds break for breathing. So what we encourage you to do when you're given that those 30 seconds to breathe, breathe deeply. What do I mean by telling you to breathe deeply? So this is how we breathe. You take deep, long breaths so that you can be able to acquire more and more oxygen for yourself and also for that baby, because the baby is still using your oxygen. So you have to take deep and long breaths. So you breathe in, you hold, then you breathe out. And you breathe out with your mouth open. The reason why we encourage you to breathe out with your mouth open is so that you can be able to release yourself, release that pain, or even relax your muscles. Once you're relaxing your muscles, at least you are not able to feel so much pain on those contractions. So when the contractions gives you that break, your job is to breathe in and out, breathe in and out, deeply, deep breaths in, out with your mouth open. Then when now our contraction is back, what you do, take a deep long breath in, then you hold that breath. Okay, so you breathe in, you hold the breath, then of course the midwife will be assisting you and showing you where to hold your legs. You have to hold your legs, lift up your head. You have to lift up your head. Remember, you have held your breath. Okay, once you lift up your head, now you can push. Now that is the way, that is how you'll release now that air, the air that you had breathed in deeply and longer. So now you release it when you are pushing. Now you'll push while releasing that air. And there are things that we encourage you to do. When you are breathing out that air and when you are pushing, avoid making a lot of noise. Okay, avoid making some sounds when you're pushing the baby. Reason is, most of the people, will be pushing, but a lot of energy is being brought into making that, producing that voice or making that voice. So you find that you're not giving too much energy to push the baby, but instead that energy, most of that energy is going to you making that sound or that voice. That is why we will advise most of you, please do not make noise. But others might shout, but they're still pushing. Okay, they're still pushing down there, but they're still maybe kind of making some loud noise and all that. So it depends. When we tell you it's okay, mama, just continue pushing and you're making a noise, it means we have already seen that you're doing a great job down there and you're pushing your baby. Okay, but if we tell you to close your mouth, it means we have noted that you are using a lot of energy to make that noise rather than pushing your baby. That is why you will find that there is a mother who will push while making noise and shouting, and it's just okay. The midwife will just be okay with that because they are assessing you and they are seeing that you're doing a great job pushing your baby down. Another thing, and the most greatest thing to do also, is cooperate. Listen to what whoever is around you is telling you. At that moment, I will be there as a midwife who will be conducting the delivery or assisting you to receive that baby when the baby is being pushed. I will have an assistant nurse who will be around there, maybe assisting you to lift up your head or assisting you to hold your legs and all that, and encouraging you. And all of us will be there telling you and encouraging you to push and push, mama do this, mama do that. And also in some cases, if in case your spouse is there, also we encourage your spouse at that moment to keep encouraging you to push and push. So at this moment, I don't expect you as a mama, because you're feeling so much pain, because the contractions are so much impulsive. Now you start telling me, oh, me, I don't even want this. No, me, I don't, just do your way to remove this baby out. Oh, mama, let me tell you, when we are at second stage and already we have we can see your baby's head coming out, the only option you have here, we have here, is you push that baby. I will not be able, I cannot insert my hand inside there and pull your baby out. No, that one cannot happen. So I will not tolerate you telling me to do whatever I want to do to just make sure the baby comes out. No, we need the highest order or the highest rate of cooperation from you as a mom. You need to push this baby out. And once you're pushing this baby out, and once the head of the baby is out, then the rest of the things I will just know how to maneuver, just in case, because of one reason or the other, you are not able to push the rest of the body of the baby out. But once the head of the baby is out, at least the others, we know how to maneuver about that. And also I want you to note something. When you have already pushed the baby out, these things, the way God created us, and it is so funny how God had to create this. It's just funny, because most of the times these things will just occur somehow by themselves, somehow naturally. So once you push the baby out, this fetus, this baby, also is created in a way he knows the head is out. Once the head is out, I'm supposed to rotate my anterior shoulder and also try to bring out the anterior shoulder. So you find that in most successful cases, once the baby's head is out, the baby will automatically rotate its shoulders, and the anterior shoulder or the first shoulder will be pushed, like he will push or she will kind of push the first shoulder out. So what I will do as a midwife, I will just hold here or hold the head sideways and try now to maneuver the baby to deliver its other shoulder, its posterior shoulder or its second shoulder, and then push your baby out, or just swiftly remove your baby out. But I'm telling you, these things most of the times will occur naturally unless we have some complications. Unfortunately, we will still cover all this, don't worry. We have some obstetric emergencies, things that we call obstetric emergencies. These are conditions which might occur and will render us taking you, a mother, to theater. Now, once the baby is out, we have some conditions that can occur. Number one, and the most greatest of all that can occur, is what we call a shoulder dystocia. What I'm telling you, that the baby's once the baby's head is out, the baby is able to automatically rotate its own shoulders. We have some cases where the baby might be a bit bigger, then once the head is out, the baby fails to rotate its shoulders. So what happens? The baby's shoulders become locked. Once the baby is out, the baby's head is out, the shoulders become locked. Okay, so you can see this diameter and that opening is small. So what happens? These shoulders get locked up, so the baby cannot be able to move out. So once the baby is stuck there, okay, also as we are trained, we have so many maneuvers. We don't have to take you to theater because you have a shoulder dystocia. We have a lot of maneuvers that we have learnt in school, which we can use to make sure that we rotate those babies' shoulder and deliver your baby safely and successfully. But though unfortunately, we have like I can say like 4% in 100 women, or 3 or 4 women in 100 of them might not be able to successfully maybe deliver that baby, because once we are doing the maneuvers and all that, especially if the baby already had already started getting fetal distress, unfortunately some of them might lose their babies. But the highest percentage, 97% of women will still deliver successfully with those maneuvers that we use to deliver that baby out, or to push that baby out. So we need a lot of cooperation from you. So you give me a strong push, then down here I know what to do. I know what to do. So we need cooperation between me and you. Me and you. So once I am here, I'm the one who is seeing whatever is happening here. So when I tell you, Mama, you need to push stronger than before, it is because I have seen whatever is happening here. Sometimes I will tell you, Mama, just breathe. You still have a contraction. No, just hold on that contraction. Breathe strong. Let us gather, just vumilia that contraction. You breathe. We wait for the next contraction. That is when you will push. Cooperate with that. When I tell you that, please kindly make sure you cooperate, so that at the end of it all, we want to remove this baby, or we want to deliver this baby safely and alive. That is what will give us happiness. Not only you as a mom, but also me as a midwife. That is the most thing that will give me happiness. A successful delivery, not even a successful labor, but a successful delivery. Making sure that we deliver this baby alive and without complication, with no distress, with no breaking of the shoulders, with no breaking of the baby's hands, or even with no trauma in the baby's head. So you have to cooperate. Me and you have to work hand in hand to ensure that is done. So guys, this is all about second stage of labor, and the reason for all this, or the reason for like such a video, is to create awareness and to make sure that I inform you as a mom, so that a mom or a mom to be, so that at least once you hear nurses saying second stage, I mean we are in second stage of labor, at least you know what is expected of you. You already have the knowledge and you understand why is the nurse right, like you'll be understanding why your nurse is telling you to do this at this specific moment. You'll understand very clearly why your nurse is telling you, Mama do this, Mama do this, Mama do that. Okay. Well, about the positions in which you need to see, or to sit or to lie on when giving birth, depends on your comfortability. Most of the women will deliver when they're sleeping, lying on their back, um, flexing their legs, yeah, and all that. But others might prefer squatting. Others will. We have so many positions in labor ward. So once we are there, and I realize that this is the perfect position for you, or even when you are lying on the normal position, but I realize that your baby is still not being pushed the way I want it to be pushed, I might advise you to change the positioning. And we are doing all of this so that at the end of it all, our aim is to deliver this baby as fast as possible, or as soon as possible. Because remember, you as a mom also, with those contractions and with all that labor, you're still tired, you're getting exhausted at this point. So we don't want you to I don't want you to get exhausted when we have not yet delivered this baby. We need to deliver baby for the benefit, for the best of yourself, because you need to get relieved, and also for the best of this child. We don't want this baby to get fetal distress. We don't want to cause trauma, especially in the head. Remember, any trauma in the skull, in the head, might cause a trauma in the brain. And once we get a brain trauma at this moment, that is when we find a lot of kids being delivered, or a lot of babies being delivered, and later on develop what we call CP, cerebral palsy. Cerebral palsy, mostly, this is the moment now your child can be affected. Your child brain can be affected, and they end up suffering from cerebral palsy. That is why we insist. This is a very crucial stage of labor. Kindly let us cooperate. You and me, let us cooperate to make sure that we are delivering this baby safely and successfully, healthy and alive. And also, do not hate your midwife for becoming so harsh on you in second stage of labor, because maybe your behavior at that time contributed, or you were not cooperating, and it contributed to your midwife developing, all of a sudden developing a kind of harshness to you, and a kind of yeah, let me say harshness. Okay, me, I always appreciate when even if I develop a kind of harshness at that second stage, once we deliver the baby, I feel so happy when a mom will still appreciate me and tell me, because most of them will tell me, hey, Shiro, if it were not for you, the way you became harsh to me, I couldn't have done this successfully. Most of them will realize, and they will realize that enyewe, it is that harshness, your harshness, caused me to push the baby harder. And you see, when I've been smiling with you all along, then all of a sudden I change my face, because yeah, I really do. Most of the people will not agree that I can be a tough nurse, but those we have met in labor ward and maybe tried to joke with me at second stage of labor, or my fellow colleagues, they can really attest to this, that I can change all of a sudden, because I don't want to lose this baby. I don't want to be blamed, that because most of you you'll blame me, the nurse. Oh, I brought my wife here, I brought my sister, I brought my friend here to deliver the baby. The baby's heartbeat was okay. How did she end up losing this baby in your hands? So that is why I have to be harsh. I will try always to make you cooperate. Hii ni cha nguvu tu. I will have to make you cooperate so that we can do this successfully and happily. So guys, that is all we need to know about second stage of labor. Kindly, we can get to interact in the comment section. Those who have undergone labor and those who have done successful normal deliveries, maybe you can share your experiences. Share your experiences on how your nurse maybe treated you, or how your nurse handled you when you were in a second stage of labor. Let's get to learn. Now that you understand why, in case your midwife was harsh on you, now you get to understand the reason why she had to be harsh on you is because of all what we have talked about. So that is it for this video, and that is it for the second stage of labor. In other videos, I will talk about maybe those emergencies and how we manage those obstetric emergencies, just in case we get such an obstetric emergency when the baby's head is already out. I will explain and I will tell you, because I want all of you to get informed. Even if you are not a mom yet, this video might help you in future when you already carry your pregnancy. And that is why I always encourage us, let us share our experiences, and let us try to encourage each other. And guys, we are women and we are very strong. God created us in a way that we are very strong. Otherwise, if we are not strong, all of us in this world could only bear one child, one child. But you find that we have myself, right now, myself, I have two boys. Okay. you will find a woman who is going into labor for even the sixth time. It's because we are strong. So don't undermine yourself. You can really do it. Once you get into labor ward, mama, just know that you are a strong creature, and just know that you can really do this. You can push your baby out. You can do this. You will be strong. However those contractions will be impulsive, like however strong it will be, mama, you are a strong creature and you will do this successfully. Just come with that positive mind in labor ward, and just come loving, and just love that nurse, just love that midwife. Try to joke with them, try to make them happy, like just try to create a calm and a conducive environment, so that they can also be willing to help you. They can also do their best to make sure they assist you. So that is all about that. If you have not watched the previous videos, make sure you do so, so that at least you will be able to understand with this video more and more. And if you have not yet subscribed, oh my god, it is just free. Please kindly hit that subscription button, subscribe to this YouTube channel, join this family, so that we can be able to enlighten one another and also inform one another, because knowledge is power. So thank you so much for watching. Until the next video, bye bye.